Hello everyone. Today we are going to study the motor nerve supply of the face. The motor nerve supply of the face is by the facial nerve, which is the seventh cranial nerve. Now here in this picture you can see the extracranial part of the facial nerve, but the facial nerve has started long ago, deep inside the brain stem. So we have a nuclear part of the facial nerve which is within the brain stem, and its nuclei are a motor nucleus which is supplying motor fibers through these nerves. Then it has a sensory root which is actually taking back some proprioceptive fibers from these facial muscles, and this sensory part of the facial nerve supplies a small area within the concha of the auricle and in common with the auricular branch of the vagus. Then apart from its motor nerves, ordinary motor nerves to the muscles of facial expression, it supplies parasympathetic motor nerves. Parasympathetic motor nerves are meant for some of the salivary glands, not the parotid gland, which is supplied by the glossopharyngeal, but the submandibular and sublingual glands, and also the minor salivary glands within the walls of the oral cavity and the nasal cavity. These are also supplied by the facial nerve. So you have a nuclear part of the facial nerve, then there is the exit of the facial nerve from the brain, then there is a course of the facial nerve from the brain to the internal auditory meatus within the cranial cavity. Then inside the petrous part of the temporal bone there is an intrapetrous part of the facial nerve. Then there is an exit of the facial nerve from the stylomastoid foramen, and when it comes out of the stylomastoid foramen somewhere here, it enters the parotid gland. So you have an intraparotid part of the facial nerve and the terminal branches of the facial nerve. So let us look at the exit of the facial nerve from the cranium, which is from where we can actually begin our discussion. You see here, you can see the exit of the facial nerve from the stylomastoid foramen, and you can see that the facial nerve is going towards the parotid gland, and you can also make out that the facial nerve immediately on its emergence has given off this branch, the posterior auricular nerve. This posterior auricular nerve will supply the occipital belly of the occipitofrontalis and a muscle attached to the pinna called the auricularis posterior. Not only that, it gives this branch to the posterior belly of the digastric. This also supplies another muscle, the stylohyoid. And then you have the rest of the facial nerve which is about to enter the parotid gland, and within the substance of the parotid gland it has divided into a temporofacial trunk and a cervicofacial trunk. So we can now go back to this picture. So again, in the parotid gland you can see that it is split into a temporofacial trunk and a cervicofacial trunk, and again from the same temporofacial trunk you can see that it has given up these temporal branches and these zygomatic branches. So temporal branches in green, zygomatic branches in red. These are from the temporofacial, and from the cervicofacial branch you can see that there are multiple buccal branches. There are some marginal mandibular branches in blue, and there is a cervical branch. A few cervical branches descending down into the neck, and over here this structure is the parotid duct. Now these muscles of facial expression, which are muscles derived from the second branchial arch, are supplied by the facial nerve. But the masseter, this bulky muscle, although it is on the face, this masseter is not supplied by the facial nerve, rather it is supplied by the mandibular division of the trigeminal nerve. So these muscles of facial expression are supplied by the facial nerve, and let us see how. So in this picture you can make out that these muscles of facial expression, they are being supplied by the facial nerve. So if you take the temporal branch, it rises up over the zygomatic arch. It supplies two muscles which are attaching the cartilaginous framework of the pinna to the epicranial aponeurosis and the temporal fascia, the auricularis anterior and superior. And the temporal branch supplies the frontal belly of the occipitofrontalis. It supplies this corrugator supercilii muscle and the upper part of this orbicularis oculi. Next you come to the zygomatic branch, going just above or just below the zygomatic arch. It supplies the lower part of orbicularis oculi. These two are from the temporofacial. Now you come to the cervicofacial trunk. from the cervicofacial trunk, you can see that there are multiple buccal branches, of which this is the upper buccal branch, this is the lower buccal branch. Apart from that, you have a superficial buccal branch which will supply the muscle procerus. However, this upper buccal branch will supply the muscles going to the upper lip and the muscles on the side of the nose. That means it will supply zygomaticus major, zygomaticus minor, levator anguli oris, levator labii superioris, levator labii superioris, alic nasi, muscles of the side of the nose, that is the nasalis, and the depressor septi. And then you come to the lower buccal branch supplying the buccinator and the orbicularis oris. And next we come to the marginal mandibular branch. Marginal mandibular branch is along the lower border of the mandible, and marginal mandibular branch will supply the muscles going to the lower lip, that is incisivus inferior, mentalis, depressor labii inferioris, depressor anguli oris, and the risorius. These muscles of the lower lip are being supplied by the marginal mandibular branch, and you are left with the cervical branch, which descends into the neck and supplies the platysma, of which the risorius was a continuation. So now you have seen the entire distribution of the extracranial part of the facial nerve. Now regarding some amount of applied anatomy, this extracranial part of the facial nerve can be damaged in a condition called Bell's palsy. It is actually an idiopathic lower motor neuron paralysis of the facial nerve, mostly due to a swelling of the nerve in the stylomastoid foramen. So in the stylomastoid foramen and facial canal, if you have a transient inflammation, that swelling usually causes a damage to this part of the facial nerve, leading to facial paralysis. Usually it's a partial paralysis, but this sort of lower motor neuron paralysis is called a Bell's palsy. Now, lower motor neuron paralysis affects both the upper facial muscles and the lower facial muscles. Apart from Bell's palsy, such a condition might also occur due to iatrogenic damage in surgery of the parotid gland and surgery of the middle ear, or fractures of the petrous temporal bone. Now, if there is a Bell's palsy, then there will be a deviation and asymmetry of the face, and face is usually deviated towards the healthy side, because the paralyzed side will become limp, and so the healthy side will drag the facial soft tissues towards it. However, you must keep in mind that if there is an upper motor neuron lesion of the facial nerve, then the upper facial muscles usually escape, because it is said that the upper facial muscles have innervated from both sides. So because they have a bilateral innervation, upper facial muscles are escaping in upper motor neuron facial palsy. Now, which part is the upper motor neuron of the facial nerve? The supranuclear connections of the facial nerve, that is from the facial nerve nucleus upwards into the cerebral hemisphere and the thalamus, into the cerebral cortex and thalamus. These are the upper motor neuron fibers, that is the corticonuclear fibers. And the damage to the facial nucleus and the course of the facial nerve below the nucleus, that is the lower motor neuron type of facial palsy. I think that's all for today now. Thank you.